So now that I've got the housekeeping out of the way, I want to introduce our kind of keynote MC person who's going to be leading us today. I want to welcome Julia Yarbo. Julie is an outreach and education she's an award-winning broadcast journalist, a communications consultant, and a freelance writer. She is the creator and publisher of Keep It Real Caregiving, which is a Substack channel. And we're also super, super, super fortunate to have her as an AARP volunteer. So, Julia, I'm going to go ahead and toss this over to you to continue today's presentation.
All right. Thank you so much, Christina, and thank you all for joining from wherever you're at in the country. We really appreciate your time. Uh, as Christina said, I'm Julia Yarbo. I'm here in Washington State, and my background that brings me to this is that I spent many years as a hands-on caregiver to my elderly, now deceased mother, and so I saw a passion for wanting to help share information with other people. Today, we're really excited as we move through this information, and we do have a lot of it. We have a special guest with us that I'm also now going to introduce, and I want to make sure that I have his title and background absolutely correct. So I'm going to read it straight from my notes. I would like to introduce to you Jeff Young. He's an outreach and education specialist at the Centers for Medicare and Medicaid Services, CMS. I'm sure you've heard of that, and if you haven't, that's what that stands for. He serves Alaska, Idaho, Oregon, and Washington. That means he is busy, so we really appreciate his time. He leads presentations, trainings, and community events on Medicare programs across the region. And I do want to point out that once you start hearing Jeff's expertise and what he shares with us today, he has been in this field for 5 years. So keep that tucked away as we move forward and think, wow, this is such an experienced individual that we have with us today, and imagine what's going to be happening in the next couple of years with his passion to be involved in this. So Jeff, welcome. Really appreciate the time. So how about let's talk caregiving, navigating new insurance, because as we've started this year, that is a big topic for a lot of people. What are we going to cover today? We've got a lot packed in, but as Christina said, we want to keep this interactive. If you have questions, drop them into the chat. We're going to try to keep it moving, but it's not a race, right? We may get through a lot of the content, perhaps not all, but we hope to be able to make this available to you at the tail end. The agenda, we're going to talk about some of the cost and the new requirements with insurance and the benefits, Medicare costs, and some key considerations that all of us need to be aware of. One that I hear quite often that I experienced caring for my mother, Medicare Advantage versus Original, right? Two very different pathways. Part D and comparison tools. If you're new to Medicare, you go Part D, Part A, what am I doing, right? So we're going to walk through some of that. We're going to talk about something called the guide model for dementia care. A lot of great information down in this that we'll break apart. And then, as Christina said, we'll be able to share some resources with you. Before we dive in and bring Jeff in for the first delving into this, quick reminder, we always want to let everybody know this information is just that. It's information, it's discussion, it's sharing resources. This is not professional legal or medical advice. So always keep that in mind. So Jeff, go ahead and unmute and let's start sifting through some of this. We started 2026, a lot of folks looking at their new plans and trying to sift through, what do I do? Insurance landscape is changing. Care models are changing. What states are offering is changing. What are some of the big things that folks need to be aware of or just be on the lookout for that could be in the change bucket?
And thank you all for having me here today. So one thing I always like to mention when talking about Medicare before is you'll hear me use a lot of terms frequently. And I do just like to identify them very briefly for everybody. I'm sure you're familiar with them. It's just something I like to get out of the way. Is a premium is an amount people pay for their monthly coverage for health insurance. Deductible is the amount paid before that coverage kicks in. Copays are amounts paid along with the service. For example, a doctor visit may have a $20 copay, for example. Coinsurance is another term that you'll hear associated with Medicare a lot, that Medicare pays 80% of covered services, and the beneficiary typically pays the other 20%. So I just want to get those terms out of the way. Copay, coinsurance, premium, deductible. That's where you'll see a lot of these costs. So each year, Medicare plans can change what they cost and what's covered, which is why we always stress a couple key points year round, and particularly during this open enrollment period, which is October 15th to December 7th. And the thing that we always remind people to look out for, to know what's changing, to get an idea of costs and coverage changes, is the plan will always send out what's called an annual notice of change, or an ANOC. We love acronyms and abbreviations here in the federal government, so you'll hear me use them frequently. The annual notice of change, or ANOC, includes changes that the plan may be making to coverage, costs, or service areas that are going to change for the following year. The other item that they send out is the evidence of coverage, or EOC, more acronyms, which gives a detailed plan coverage information. So these are always the first things we want to make sure beneficiaries are looking at to see how their premiums are going to be affected, how deductibles are going to be affected, co-payments, and network change. Sometimes plans can also change mid-year. So always want people to be aware of those topics.
Let me ask you something real quick on that,
Yeah.
especially during that open enrollment period. We see a lot of commercials from different companies. We get a lot of mail coming into, old school mailbox letters.
Mhm.
What items should individuals make sure that they are looking for, so that they are understanding that if they are receiving that, the annual notice of change, that it is official and that it's the information that they should be following? Any clues and items to keep an eye out for?
Yeah, absolutely. So, and this is where things, as you mentioned, it do get very confusing, because Medicare Advantage plans, these MA Part C or Part C plans, what are them called, will send out mailers, flyers, they will call, they will be at informational events trying to sell a plan. That's what they're trying to do. They're trying to enroll people into an Advantage plan. Now, we always want to be on the lookout that these are private plans sold by private insurance companies that follow rules set out by Medicare. We set out rules these plans must follow. There, of course, we always need to be aware of potential fraud or misleading advertising. And what we always do recommend is, if there's any kind of solicitation to enroll in a plan or anything someone might not understand, you can always feel free to call our 1-800-Medicare number and report that. We do have fraud alert teams. Also, your senior Medicare patrol in the state is another great resource. If you're unsure of, hey, why am I getting these mailers? I don't know if this is legitimate enough, or what's going on with them. But you will see they are legally allowed to send flyers out to about these Part C plans.
And oops, there we go. I love that you broke that out for us a little bit. And we started talking about the difference between Medicare Original and Advantage. Are there guidelines that an individual or somebody who's helping a loved one, what would they base some of those decisions on, or what should they look for to understand the differences between those offerings?
Yeah,
And
that's a
is if it's offered in your area, um, are there different limitations that might be built into an Advantage plan?
Absolutely. It's a great question. I think this really comes to that Medicare, original Medicare versus Medicare Advantage. And I think I saw someone put in the chat, just as our kind of level set, that original Medicare is that Part A hospital insurance and Part B medical insurance, and often a separate Part D drug plan. We call that original Medicare. And then there's Medicare Advantage Part C, which we've been discussing. And so when we're comparing the two, this is really important, and probably the meat of what we talk about today is understanding Advantage versus original Medicare. The first, and I have a few key points on this, and I apologize, this will probably be my longest answer of the day because this is the most complex part of it, I would say, that we talk about. The first thing to consider is always cost. An original Medicare, so that Part A, B, and usually Part D, there's no limit to what a beneficiary may pay out of pocket per year, unless they have what's called a supplemental or Medigap plan that can supplement and help pay the costs of original Medicare. A Medicare Advantage plan does have out-of-pocket limits for covered services. Regarding coverage, original Medicare covers medical services and supplies, whether it's covered under Part A or B, and Medicare Advantage plans must cover all the same services that original Medicare covers as well. In addition to, sometimes these plans will cover things like vision, hearing, and dental. But I just want to stress that point one more time. Everything original Medicare covers, Medicare Advantage plans are also required by law to cover. Now, I mentioned supplemental insurance. It's a consideration with original Medicare because original Medicare pays a lot of, but not all the costs. So that deductible, coinsurance, copay, if you're on original Medicare, you can opt in to purchase a supplemental or Medigap plan. These plans are all the same across the country in the sense that you can have a plan A through N. And this will get complicated because you have a lot of letters attached. But a G plan, for example, here in Washington is going to be the same as a G plan in Texas. They're all standardized. The only difference with these Medigap policies is the cost and the company that sells them. But I do want to reiterate a key point with these Medigap policies. They only work with original Medicare. So just think of it as a way to help pay the cost of original Medicare if that's the route you're taking.
And if I could ask this, and I don't want to veer too far off of our path, but in terms of an individual, and they start looking at all of this, and we know we have that open enrollment October 15th through December 7th. Two questions as we break this out for folks. If they miss that window, what should be the first call that they make? Or if they haven't enrolled at all for whatever reasons, let's say I've turned 65, but I didn't enroll, what should be the first call they make to have that safety net so that they can get into one of these plans?
Yeah, so the first one, it's our first question first. So that open enrollment period ends December 15th. But if you're on an Advantage plan already and you miss this, there is a Medicare Advantage open enrollment period just for switching Advantage plans that runs through March. So there is an option to switch plans, Medicare Advantage plans. But I think the bigger key here is if you miss your initial enrollment into Medicare, the next opportunity to enroll is in what's called the general enrollment period, which begins in January, and that can lead to a gap in coverage or a potential late enrollment penalty. So what we always want to be very clear on is as people get close to Medicare eligibility, that they make sure they do not miss that initial enrollment period and contact Social Security to enroll in Medicare as soon as eligible.
Good advice. And I have a relative who actually fell into that gap, and it took quite a bit of phone calls and maneuvering to be able to get a plan, have coverage, and then avoid those penalties. So those dates are really key. So for somebody who still may say, well, I don't understand the difference between a Medicare Original and Advantage,
Yeah.
where would you say is the best official portal to be able to read that information or to turn to? I know I signed up for a local Medicare informational session because I knew it was a lot of information.
Yeah, absolutely. So the place we always recommend is, of course, our website, medicare.gov. It's our government website. And this is a wonderful resource because I know government websites are not always the best, but our medicare.gov and /plan compare website does feature a number of very, very useful tools to search for providers, search for specialists, compare plans side by side. You don't even need an account on Medicare.gov to look at plans side by side, look at benefits. You can enter in, say, your zip code where you live, see what doctors are in that plan's network, or see what providers are accepting Medicare. And mentioning the other one place to get resources for this that I do want to give a brief plug for is our 1-800 Medicare line. Our wait times are typically under 5 minutes, usually about 3 minutes, and it's open 24/7 except for Christmas and Thanksgiving Day. And we have a team of people at our call center who can answer individual questions. You can report fraud. You can ask about plans. They're a wonderful resource that you can trust. And the last one is, as you mentioned, a Medicare learning session. The other place to always look for, especially if you need individual counseling, is our state health insurance benefit advisors, also called the SHIBA. And thank you, Christine, for putting the information on there in the chat. But what you can do is this office exists in the Office of the Insurance Commissioner here in Washington State, and they have trained counselors and volunteers who can sit down and help you one-on-one, go through this plan finder tool, go through the medications you take, the providers you see, and start to sort through this when you need that kind of assistance. My last thing to say on them is make your plans early and be prepared with the drugs you take, the providers you see, those types of things before your counseling session.
Yeah, and I love that you said, check your providers early. So two things I wanted to blend in together on that. Is it this could be a which came first, the chicken or the egg? So when you're looking at your plans, do you check your doctor's list of which plans they take? Or do you choose your insurance plan and then find a doctor that matches it, especially if we're talking about a Medicare Advantage? That tends to come up with people where there's been a change with their provider, and all of a sudden the person they've been with no longer accepts the coverage they have. Any guidance on how folks can navigate that none of it is easy, right? It takes a little bit of focus, but what could be some smart first steps, and what items should they have prepared for them to be able to take those next steps?
Yeah, I think for the most part, I always use my dad as an example actually of this. Is he really liked his doctor at the polyclinic. And so when he found out his doctor at the polyclinic would no longer be in network with his Advantage plan, he then looked for a Advantage plan that would keep that that would have those doctors in his network, and actually wound up going back to original Medicare because they were in that network. So what we hear the most is that when people like their doctors, they're comfortable with them, then we want to go that route. However, one of the things to also consider, and again, I do recommend that Medicare Plan Finder tool as an option, but also these plans have to provide that information. If you're signing up an Advantage plan, whether it's Regents or Humana or any of the plans out there, they do have to provide that information, and never hesitate to call and say, hey, is this doctor in your network? That's what they have to do. So that is always an option. It's always get in touch with the plan first and make sure that the doctor you're seeing will be in network and their services will be covered.
And would that advice be the same for our prescription coverage? Let's say our medications change. Is this a moment to also look at the list to discover if any of those medications that have previously been covered have maybe moved into the non-covered? And how do we approach that aspect of our insurance?
Yeah, absolutely. I know it's one more thing to consider and look at, but like I mentioned on our first question here, was that plans do change what they cost and what the coverages are, and those formularies for these Part D plans can change. They are required by law to let you know any changes. But if missed it, I mean, things get lost in the mail, very understandable. Again, just like with Advantage plans, can check the website You can call the plan, or you can use our website, medicare.gov, to look and see what pharmacies are in that plan's preferred network where you'll get the best deal on your covered medication. And then, of course, what that plan formulary is, which basically is going to tell you how much you pay for the drugs that you're taking. And that's such a key step in always being aware. I always recommend before making any changes and every year during open enrollment, making sure you know the drugs that you're taking, and where they are in the formulary. It can definitely take a little prep, a little planning to get it all written down and look at and compare side by side, but it's such an important step to avoid any gaps, or say needing to go to a pharmacy that's too far away, or is no longer in your preferred pharmacy network.
Right. And of course, right now we are all of these topics fall into the reality, the umbrella reality right now that I'm sure many of you on the call might be facing, or know somebody that we are seeing a change in how hospitals are organizing, rural versus urban coverage, consolidation. So all of that is the big umbrella that then we're moving through. So when we think about that, let's kind of drill down into some of these other key considerations. We've talked about this in our conversation, but so we talked about the provider verification. Make sure that your doctors are still in your plans. Call your doctor, and as you said, your dad would move around and make sure to find the plan that matches the doctor. We talked about the prescription coverage information. Um, we talked a
Yeah.
little bit about the cost, but that is crucial to understand what your out-of-pocket costs are going to be. Um, do we always read the fine print? Do we just read the numbers on the top? And how do we ensure, or what steps should we take to make it a little bit more, or a little clearer for ourselves of what types of bills we might be receiving?
Yeah. So the baseline part is, Medicare Part A, most people are not paying a monthly premium for. You've been working in the US for at least 10 years, and you're not paying a premium for that Part A hospital insurance. But Part B, most people do pay a monthly premium for. This year it's $202.90 a month. Plus, Part B also has a deductible of $283 per year. So those are kind of those every year you're going to have those, whether you're on an Advantage plan or not, you're going to pay a Part B premium. Some of these Advantage plans have no additional premium. They're $0 premium. You just pay your Part B premium, whether it's out of your Social Security or you're paying online or sending a check. Some of these Advantage plans, however, do have a monthly premium. And that's again when we're reviewing our annual notice of change, be very aware of those premium costs because they can go up. Or if you're switching plans from, say, a zero premium plan to then a plan with a premium, that's going to be on top of that Part B. Also, like we've discussed with costs in general, if you're on original Medicare, you will get what's called a Medicare summary notice, which will run through all the costs for you. And then we'd mentioned a few of these things like copay, coinsurance, all those things that are always to be aware of. The plan will have to provide that for you. You should always be aware before switching plans or before seeing a provider what your copay or your coinsurance will be. So always important things to review.
Yeah, and that I can't stress enough that having that level of awareness and really tracking your own information. And just real quickly, on the personal side of having cared for my mom, I recall receiving all of the different statements, and I made absolutely certain each month to read through everything, to also cross-reference any billing that was coming from doctors' offices so I could understand what everything was called, how it was being billed, what I needed to do. Was there anything outstanding? And there's so much great information here. And I'm going to just say to everybody on the call, it can feel overwhelming. I know I've lived it. Jeff, you work it, and it still feels like a lot. So I wanted to just take a brief moment and see because we've given you a lot already. Are there any questions as we continue moving through items? What comes to mind if somebody has a hand up or wants to drop something in the chat? Um, we don't want to fry your brains with information, but we also want to make sure that we have some interaction if there's something particular that we could touch on. So, Christina, I will trust you to keep an eye on that chat, and we'll just keep rolling. And then if somebody drops something in there, we'll pause and come back. Right? Sound like a plan, everybody? Okay, I can't see you, but I see heads shaking yes. I'll assume that's a yes. Um, One of the
And
things that really threw me when I first started was understanding that the parts of Medicare and our coverage and understanding what that meant. Um, Part D is specifically about our medications, correct? If you think of it in a really simplistic terms. Um, is that something we get to choose that's different from state to state, region to region, or is that a fixed item? How do people approach that? What's the
yeah.
safest, smartest, most effective way to approach this and to understand it?
Yeah, so Part D drug coverage, similar to Advantage plans, these are sold by private insurance companies that follow rules that we set out. So all these plans, whether it's Washington or Arkansas, follow the same set of rules and regulations set up by us at CMS. In that sense, there's a lot of similarity. However, these plans do have some leeway in costs, in their formularies, in any restrictions, and some of those can vary a bit based on zip code. I mean, here in Seattle, just like with Advantage plans, there's a lot of Part D drug coverage options out there. Some places may have fewer options, say in Fairbanks, Alaska. You can have fewer plans out there offering drug options. But the important thing with Part D to consider is because this is about the drugs you take, a lot of these plans will have things like to be aware of that are you might consider restrictions. For example, prior authorization. And this is prior authorization basically means the plan must approve the drug before they will pay for it. And this is something you'll see in Medicare Advantage as well, where the plan must approve before they will cover a certain drug or an Advantage plan a certain covered service. So it's something to be aware of, especially when choosing your plan is are they going to make you engage in prior authorization for a certain drug? Another thing to consider with these Part D plans is what's called step therapy, meaning they may require you to try a cheaper version of a drug before they may cover the non-generic or more expensive drug. The other things to consider are quantity limits. I mean, transportation mobility can be a challenge for people. And if a certain drug you can only get 30 of per year, meaning more trips to the pharmacy, that can be a burden and something to consider that maybe not everyone would think about. And then beyond that, it's premium and annual deductible and copay. All information that needs to be laid out, that is laid out on their website or on our website, wherever you're reading about this Part D coverage. Also, their pharmacies that are in their preferred network is something to look at. More pharmacies are offering more of these plans are offering prescriptions through mail order now. That's something that's more and more common. And again, if mobility is a concern, that may be something to consider that might fall outside that, oh yeah, Part D drugs, we can get these shipped to us potentially. And then lastly, of course, just like with Advantage plans, these Part D plans all have star ratings you can find on our website, which follows a criteria laid out by CMS on how good a job they're doing in delivering this coverage.
And just as I listen to you walk through this and I think about my different pharmacy experiences, um, I would imagine that it may feel old-fashioned to a certain extent, but would you say that it's a good thing to establish some sort of relationship with your pharmacist if you're in a community that you're able to do that, so that if there are changes in the formularies or changes with insurance, that you have that rapport with them to be able to navigate a little easier? Is that something and again, it feels like maybe that's something from the past, even in our large cities, but do we need to try to establish that?
Yeah, absolutely. I think the pharmacist being your frontline person that you're going to deal with when getting your drug, they're always going to be aware. We actually work quite closely with pharmacy associations across the US to make sure your pharmacist is up to date. They're familiar with these plans, they're familiar with our rule changes. They can be an excellent resource out there. Thank you for bringing that up.
Yeah, no, and I'll give a quick shout out to the pharmacist that I worked with primarily with my mother, and she understood some of my challenges with time and having to fill different prescriptions, and she literally was a lifesaver for me. So very thankful for the pharmacist. Um, okay, I saw something coming to the chat, but that's being answered, so we can touch on that maybe at the tail end. Um, when I first started working with my platform, Keeping It Real Caregiving, I would say that the Medicare and You booklet or online version, I considered it my Bible. And that is not in any way to take away from anybody's faith beliefs, but it was, for me as a caregiver, it was my go-to resource. And I would say to people, read this. It's your bedside reading. So I love that our next slide, Medicare.gov, plan and compare, right? So many tools at Medicare.gov, Medicare and You, the plan and compare. What's the best way to get the most use out of these tools so that we, the consumers, the caregivers, the individuals, can get that knowledge, make the right choices, sift through what's out there?
Yeah, so first, thanks for the shout out to the Medicare and You handbook. Also, it's my bedside reading too. You can also first of all, the Medicare and You handbook should be shipped to you. You can also access it online. And the one plug I do want to give on it real quick is if you're ever concerned or need to look something up, it's all in there. And on page 76, all the Medigap policies are laid out in a really nice table. It's one of the nicer parts of that book. Just had to throw that out there. But yes, our Medicare.gov site's been updated a few times. We do recommend you create an account. If you have an account, you're able to save a lot of your information and do more customized, personalized cost estimates. You can also pay your bill on there, access your Medicare summary notice. So we do recommend making an account. Now, if someone does not want to make an account, you don't have to just do our plan compare tool, which we've updated and really allows you to you can put in your medications you take into our tool directly, and it will take you through the plans, the pharmacies, and the costs. Same with our Find Provider tool. You can put in your zip code. It's a pretty user-friendly, as in a step-by-step. You'll put in information, takes you to the next one. I think this website's come a long ways as someone who has some experience playing with government websites. We've made it a lot more user-friendly. So just the one piece of advice I would have is get familiar with this website, make an account, and start playing with it a little bit and familiarize yourself, especially before open enrollment comes around. So really ready to jump in.
Yeah, and if I could piggyback off of that for individuals who are looking for their own coverage, or perhaps a caregiver who is assisting a loved one with coverage, from personal experience. As I said, I turned to that handbook and the online versions many a time. And the first time I read through, I didn't know what I was looking at. I couldn't make heads or tails. But once I was into the role of caregiving, I realized how much valuable information was there for me. It helped me learn what questions to ask my doctors and the care team, what other services I might be able to tap into. I know this wasn't on our agenda, but for instance, if Jeff, if you can care for podiatry services, is that still part of Medicare coverage?
If it's medically necessary, yes.
And I did not know that, and it was a lifesaver for me. So again, just without getting into medical issues on this particular call, I highly encourage individuals to read through just so you have that extra information because everybody's situation is different, right?
It's so true. One of the terms we talk about a lot is everyone's situations are unique. And as much as we talk about general ideas, general advice here, individuals, of course, do have their own needs, their own issues, their own things that are coming up. So always important to be aware of them and to look into all this information. And thanks for giving that example. I think it's a good highlight of how we don't always know what we don't know, especially when it comes to the vastness of Medicare and health insurance.
That's my line that I say, you
Uh,
don't know what you don't know, right? So
uh,
let's keep sharing that information with folks. And uh, this next topic I am fascinated by the guide model for dementia care. So these are some concepts that I weren't in place 5, 6 years ago, correct?
Yeah, this is a new model that CMS rolled out to really address. And when I say model, I mean it's not a na it's not entirely adopted nationwide, but in certain places across the US, CMS is looking for ways to keep people at home, people with dementia home longer, delay nursing home placement, reduce ER visits, support caregivers, and improve quality of life. So we rolled out this model called the guide model. And the purpose of this is to provide a few things for individuals living with dementia. And what it does is it involves a care navigator being assigned to guide patients and caregivers through the healthcare system. As we've talked about today, it's incredibly confusing, and we've just brushed the surface today. Another part that this model includes is 24/7 support line that's available for urgent concerns. Included is caregiver training, which is based on evidence-based education and tools for caregivers. Included in this model is a $2,500 annual respite benefit, as well as a community connection, so links to meals, transportation, and services. And I just saw that pop up in the chat. We'll absolutely put more information on this model sent out, and I can put it in the chat as well. There are two providers. You enroll to this through a provider here in Washington. There are two participants in this model in Washington State, and I can include their information on here. I'll also include an infographic to be sent around about how this model works and our model website where you can learn a little bit more about this guide model, what it offers, how to enroll, and who's eligible.
And as I listen to you, and this is a wonderful breakdown of these services that, this vision and this a model, can we build on this? Can and or should individuals, maybe they're in a community that this model has not been rolled out, it's not available, but we could still use this as our own, as a personal guide that we could look at this and say, oh, 24/7 support line. I don't necessarily have this particular model, but can I talk to my care providers about what my hospital may offer? Caregiving training, what other resources might be right in my community through my network of people? Is that the mindset that we can start to adopt, even if the program model isn't in place in our particular communities?
Yeah, absolutely. And the goal with all these models, right, is that if they're successful, then we can expand them out and open them up to everybody because we know a lot of this is evidence-based. We know support for caregivers and respite care is so incredibly important. We know this. How can we roll this out and continue moving this forward? So absolutely.
I know I keep coming back to our members that are on the call. So according to this, we have about 24 people here. So I know you're out there. You haven't dropped off, and I have to imagine that there are some questions. Oh, look at that! There's a slide that says your questions answered tool. Um, and AARP offers that, right? And then we're here. Folks, you have Jeff right here in front of you. This is the man with the knowledge. It's the source. A lot of moving parts that might be at play. What are some items uh, that you have questions about, clarification that we can help walk you through. Um, we'd really like to be able to do that because we know we gave you a lot of information today. Um, so hands up, hands up.
It's
Make up.
also great seeing it's also great seeing some things in the chat about Medigap attached to original Medicare and all that. So just nice seeing what people put in the chat too. Thank you.
And actually, let's go back to that a little bit. And it's secondary. Earlier on, there was a question that asked about if is long-term care worth it? Long-term care insurance. Okay, so that's a different topic. However, I did want to have you touch on just that basic assumption. And I've talked with many family members and then even individuals who are covered by Medicare that the distinction between Medicare coverage is not coverage for facility care in terms of assisted living care, correct? Those are two different things.
Yeah, so long-term care is that, medical and non-medical for people, chronic illness or disability. And most long-term care involves that kind of daily help. And that's not something Medicare covers. It is something that Medicaid covers in this state, as an example, but Medicare does not cover that long-term care.
Okay, yeah, and I felt I wanted to make that very clear because there are still um, it can be confusing. And I direct experience, one of my mother's contemporaries, I asked her, "What type of coverage do you have?" I was wanting to keep an eye on her as well. And she said, "Oh, I'm fine. I have Medicare." And I said, "Well, no, 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 no. Let's talk about this." And so she had no idea of that distinction. Um, the other thing I wanted to ask about is as we move forward with the changing landscape that we don't know what's around the next corner with how care providers are navigating the insurance world, how early should individuals begin educating themselves to how Medicare works, our insurances, our formularies, the different parts? 2 months before, a year before, right now when we hang up from this call?
It's a good question because I've been out talking to people before, and I asked somebody, "Hey, do you want a copy of Medicare in your handbook?" I said, "Oh no, I'm still a couple years away. I don't need to worry about this." I said, well, the time to consider it is really as soon as you start thinking about retiring, as soon as you get close to 65, because there's quite a bit that matters with timing. I mentioned earlier that initial enrollment period is really, really important to enroll into Medicare. And some choices really matter early on. So when you first enroll in Medicare, you have this 6-month period to enroll into a Medigap policy where these companies cannot do medical underwriting. Basically, they cannot charge you extra for any kind of pre-existing condition for a Medigap policy. Now, if you wait and see you enrolled in Medicare, but you did not get a Medigap policy, so you went on Medicare Advantage, or you just waited, you may be charged more if you want a Medigap policy later on. Other considerations to think about too when coming up towards Medicare eligibility is if you're still working. Sometimes people are still working and they have coverage, group health through their employer. You can actually delay enrolling in Part B if you have coverage through your job and you get what's called a special enrollment period to then later enroll into Medicare without any of these penalties. You get an 8-month window to enroll. It's when you lose when you lose your coverage, when you leave your job and retire. So there's a lot of timing that's so important to think about and be prepared to make these choices. So I say the earlier the better. I like to talk to retiree groups as much as possible. Or if they're getting retiree coverage. I know that's not as common as maybe it once was, but some people get retiree coverage, and that's going to impact the choices they make because maybe they don't need Medigap because they're getting retiree coverage. Maybe they don't need a Part D plan because they're getting it through the VA, for example. There's just examples out there of why it's important to start as early as possible with this stuff.
Yeah, and again, just to piggyback a little bit, you make a good point. if you're still working. And this is where, if you are in the workforce, that your HR department has that information of the coverages that your company may provide about health insurance. And typically there's that phrase, there's a paragraph in there that talks about if you're also at the age of being eligible for Medicare. So this is where, march on up to your HR department and have that conversation with them as well, because the more information you can get your hands on, it's never enough and it's never too much, is really the way I can encourage everybody to think about that. Um, and yeah, thank you, Jeff. There's just so much good information. Uh, we have our aarp.org address on your screen right now, so I know you see that. We'll be
I
sending
can,
out other information, and there's a question also. Um,
yeah, I'm going to tell everyone a little bit about this answers.aarp.org
Mhm.
tool. This is something that AARP rolled out about a year ago, and you can go to answers.aarp.org. You can see on your screen, you can enter your question into the search field, and then where it says Medicare right here on the screen, there's actually a pull down menu, and there are multiple different topics that you can ask questions on. Social Security is another place where we get a lot of questions. If you put your question here within the AARP website, it kind of calls through our information, pulls information that we have aggregated from AARP to answer your question. And if there is not an answer to that question, your question actually goes somewhere into AARP and someone will get back to you on that. Which is one thing I did want to talk about. Tia, you put your question here on the chat, which is a great question. Is how can family caregivers receive any kind of compensation from the state or from programs, particularly when they've stepped away from their jobs to care for someone? Each state is a little bit different. I know here in the state of Washington, I need to say your mom is what we call dual eligible. Looks like Medicare, Medicaid. So in the state of Washington, we do have some programs. I want to be, and Jeff, you might know this. I think it's called an 1115 waiver. So some states do have a pathway to be paid for some of the family caregiver services. It's not a lot. I think probably the best place to go to maybe look for information on what you might qualify is your state's area agency on aging. Um, which every state has it. Washington, we call it W4A. So they are great. They typically have a 800 number. The area agencies on aging really do target and help family caregivers. So they should be able to provide that information for you. Another avenue to look at if you live in the state of Washington is going to the Department of Social and Health Services. There's a program that used to be called ALTSA, Aging and Long-Term Support Services. It's called something a little bit different there, but they also have information on resources for family caregivers. And I will make sure that I will be doing the follow-up email to everyone that attended today. And so I'm kind of taking some notes down of what resources to add into that. And I'll make sure I put that in there. I don't know, Jeff, if you had any more information about family caregivers.
No, that's one of those unfortunate moments we have to say you need to talk to your state about them.
Yeah,
I don't like giving that answer. It comes up more than you'd think, though, unfortunately.
it does.
Yeah, with the I did want to I know we have like a minute left, so I want to sneak one last thing in here, especially based on the last comment put in. But when if there's ever a denial from your Advantage plan for a service or a medication, you do always have the right to appeal. That first appeal is to the plan. They're always that first contact for that. So I just want to put in that plug that is always worth appealing those. They are frequently overturned on appeal. And if that gets denied, there's three more levels of appeal. So we do hear frequently frustrations with plans. I just want to put in that last little plug that's like, hey, why was this denied? You do have rights there. It's not just one and done. I know it can be a lot to put on people, and there's usually a 60-day window to do it, but it's just my last little plug tip to throw out there as we near the end of our session.
It's a great point. I mentioned to Julia and Jeff before we got on the call. I paid for my college as a pharmacy technician. And so when that doctor or that insurance company says that your medication is not covered, that is not your final stop. Definitely like work with your doctor. I can't tell you how many times I was on the phone with an insurance company getting a prior authorization to try and get medication covered. It is unfortunate that we have to advocate so hard for ourselves in the US healthcare system, but you do, and it is okay because you know your family best, you know your health best, and so never be afraid to advocate
Yeah.
on your behalf and be the squeaky wheel.
You said that perfectly, Christina, and I'll just add to that. And for Tia, just know, first of all, you're not alone. Ask as many questions of once you reach out to your area agency on aging in your particular area, ask questions. No question is off limits. Think
Mhm.
to yourself that if you were writing a book on the topic, what all would you need to know? And ask all of those questions. Ask those same questions to your care team. Ask those questions to your pharmacist. Ask those questions to any other providers. My experience was that the information that I may get from my mother's doctors, who were all very good, may not have been completely in sync with what was happening with the insurance coverage and what was
Mhm.
happening with the medications. And so I had to be the go-between. And had I not had the knowledge or kept at it, there may have been gaps. So Christina, as you said, we have to be advocates.
Yeah.
Educate yourself, start early and
Yeah.
prepare well in advance, and ask all the questions in the world so that you are prepared.
Yeah, and I will say I've got up on the screen right now. Again, this will be follow up. Our AARP has something that I call one of our best known secrets because I don't think a lot of people know that it's out there. We actually do have a toll-free caregiver helpline that is staffed by trained AARP volunteers. I believe it's Monday through Friday, and it probably cuts off at East Coast time because I feel like everything does. But the phone number is on the screen, Tia, for like folks like you, where you're just like, man, I just don't know what to do next. Reach out to our caregiver helpline. They're an amazing group. They would likely transfer you and provide you some of the services that we've been talking about today. The state health insurance programs that provide free counseling in every state by trained volunteers. Here in Washington, it's got the SHIBA State Health Insurance Benefits Advisors Program. California, it's called HICAP because every state's got to have their own acronym. Um, So, so please do avail yourself of the resources. I do think that, one of the most challenging things as a caregiver is there's so much information out there, but you don't know where to go to find it and where to get started. So please do, turn to AARP. We hope that we can be kind of the first point of contact to get you where you need to go. And I'm popping that
Yeah,
caregiver helpline in the chat right now. And I will send it up in a follow-up email.
yeah.
But
Never too early to start asking questions. And I am so excited and proud to be able to volunteer with AARP. And I will say that, years ago, I thought, oh my gosh, I'm going to get that magazine in the mail and I'm not 55 yet. And I don't want to, don't call me. Don't bother me. No. And then I started reading my mother's magazines and I thought, oh, this is fabulous information. I need to sign up. So, tell everybody you know because the information is so valuable early on.
yeah, And you don't have to be a member to access most of our
Yeah.
information. I will say, like, we do have some things on our website that are, member only, but there is so much information. And I've been with the organization for 22 years. There is so much information. We're I'm sorry we
Yeah.
didn't get a whole bunch of questions. We're at like 1 minute. And yes, everyone, I'll be emailing the slide deck, the recording, the list of resources that we've talked about. It might take me a couple of days to get all of that out to you, but everyone who registered today, even the folks that registered and weren't able to attend today, will receive a follow-up email with all of this information. Um, and we'll be back in a couple months. We're trying to do this bi-monthly. So every other month for the Let's Talk Caregiving series. And I think the next one might be on some fraud issues that you might want to be aware of as a caregiver, and things to look at, particularly if folks are experiencing cognitive decline. But then I also, Tom wrote down your note. I think we need to have an entire session on long-term care insurance. It's a
Yeah.
very complex topic. It's, very, it can be very pricey and very expensive. Yeah, Tom, I think that I wrote it down.
And ever changing, very fluid.
Yeah.
So thank you, Christina. Thank you all for joining us. This is wonderful. Thank you, Jeff. I learned a great deal as well.
Thanks for having me.
Thank you, everyone. We're so glad that you could join us for spend a little bit of your time with us today. We know you have many choices on your way to spend your day, and so we appreciate it that you picked us to spend an hour with. I look forward to sending this information out so you guys have it readily accessible. And keep an eye on your emails. We will be having this session again in January, March.
Yeah.
We will see you again in a couple of months. Thank you so much, everyone. Have a wonderful day. Thank you, Jeff. Thank you, Julia.
Thank you, everybody. Bye. Be safe.